is advanced wound care or regenerative tissue wound medicine? What we've seen in recent years is that many of the research endeavors around the world, and specifically around the country in the United States, have led to biomedical research to identify materials that promote our own body's healing of the tissues. In surgery, in colorectal surgery, in obesity surgery, and in many of the areas in which I work, in Crohn's and colitis, and lots of complex abdominal operations, difficult hernias, these areas sometimes result in wounds that are difficult to heal. Other areas involve diabetes, which often have wounds related to stumps or related to the extremities, particularly the feet and toes and amputation sites, and trauma, which also results in many wounds of extremities and areas of the body that can take time to heal. Historically, there have been a few options for how to get these wounds to heal up. The first option of sewing them up primarily, closing them, has led to infection and breakdown, and that's why we're left with an open wound. Secondly is old-fashioned packing of the wound with gauze packing that then slowly allows the tissues to fill in from below and gradually heal in. More recently, the use of the wound vac, or vacuum system, that applies some sponges and then a tubing connected to a vacuum system, and this allows the tissues to heal in as well with the aid of some negative pressure or vacuum. But as I say, most recently, the biomedical research community has identified materials or wound matrices, wound stimulatory substances, that have been shown to stimulate our own cells to heal and to vigorously cause healing activity among the white blood cells and the healing cells of our own bodies. Most recently, one of these is a porcine or pig tissue matrix that comes and harvested from the pig bladder, that has an intact basement membrane and has many stimulatory molecules that are collagen and growth factors that also contain antimicrobial properties, so that this material causes an anti-infection property about it. With placement of this A-cell material within a wound, what we see is a much more rapid healing of the tissues, really just by stimulating the body's own tissues to heal together and slowly come together. So what are the advantages of using a product like A-cell and its regenerative tissue matrix over the other more old-fashioned methods? I would say there are really 2 or 3 primary advantages. One is that the healing appears to occur more rapidly. In our study of pilonidal cyst wound healing, we saw that the pilonidal cyst wounds were closing quite a bit more rapidly, 2 to 3 times as rapidly as with other methods. Secondly would be the antimicrobial properties of the tissue matrix. This does deter infection, it does deter colonization of the wounds with bacteria that could form infection. And thirdly, I would say that it's more convenient for a person who's having the wound treated. It does not involve daily dressing changes or packing of a wound as it would if you were doing the old-fashioned gauze packing route, nor does it involve carrying around a vacuum suction device, which can be very cumbersome, attached to the bed or carried around in a backpack or a fanny pack. Using the regenerative tissue matrix, such as A-cell, allows you to forget about carrying around a vacuum suction device, but instead simply leave the wound covered, a dressing over it, and return to the doctor's office every week or 2 to have that changed and inspected and to have growth matrix material reinserted or added to the wound if necessary. So I think there's a real convenience factor that makes the tissue regenerative matrix more appealing to people who have these wounds. It involves not imposing upon partners and spouses and loved ones to do dressing changes, and it has the convenience of not having to carry around any extra accoutrements. We know that regenerative tissue medicine will continue to improve and grow, but today we definitely have some advances that in just the last few years have allowed us to make much better progress on healing very difficult wounds and healing them more rapidly, more successfully, and with less infection.